For those who were there yesterday, I thought this point was really, I need to reinforce it, so I'm going to just give you the exact same presentation as yesterday, so enjoy. So I'm going to take you back to the week before my 39th birthday. At that point, most people, when you're about to turn 40, you see 40 as a really negative event. I decided to turn my 40th into a really positive event by writing something positive every day throughout my 39th year, to turn that into a positive attitude to try and make myself more positive about turning 40. Unfortunately, within a week of me doing this on social media, it was picked up by an Irish newspaper, and I had to actually then go through with it for a year. But the point was that the benefit of actually being positive and forcing yourself to be positive had a really important effect in my life, that I started to seek out positivity. And I think one of the most important bits for me, especially in healthcare, that it tends to be really difficult to be positive in healthcare. Sometimes it feels like you're pushing up a rolling stone up a wall or a hill. And I think really in Ireland, we need to be a little bit more positive, because there's actually really brilliant things happening. There's an immense level of innovation. Thanks to Brian, he's stolen most of my points, which I'm going to make today. But I think for me, it's really important to emphasize that Ireland has a really strong place in digital health. It's a really strong place in promoting innovation. Most people, when I put this statistic up, and as I said, Brian stole it, but in terms of level of companies, Ireland is 4th globally. And this is not per capita. This is an actual statistic that, and personally I've met over 120 companies through the eHealth Connect program, which I'll talk about later. So there's this level of innovation in Ireland. But there's always been this kind of disconnect about how do we get those companies, that innovation, into our healthcare system. And I think one of the things which we sat to look at is how do we create a culture of innovation internally within eHealth Ireland and the Office of the CIO, and how do we make it easy for people to access innovation. And one of the things which we really see is that how I access innovation is going to be different, how Brian accesses innovation is going to be different, how an admin in a hospital is going to access a pharmacist or radiologist. And it's really important that we create a system within our Irish healthcare system that people can access innovation and be innovative, come up with ideas, discover new information, look at technology in the way which suits them. And I think this goes fundamentally back down to universities. And I always, as I said yesterday, it's always good to promote another university when you're sitting giving a lecture. In RCSI, this year has launched a student innovation program. This is working with the future healthcare professionals to really start at their undergraduate level to look at how they discover technology, how they come up with new technologies around unmet medical needs. Unfortunately, we actually discovered, after we called it the Student Innovation Challenge, and we're coming up with a hashtag, that we actually had a hashtag sick, which a lot of the students were thinking that we were trying to be trendy and cool, but honestly, we're not that. But this is a really important thing. It's going to be one of Europe's largest innovation challenge around undergraduates in medicine, pharmacy, and other aligned healthcare professionals, where we're looking at how we can use the bright minds, the future of our healthcare system, to come up with their own solutions around healthcare. One of the innovations which just actually came out of Galway Hospital is neurotransmitter. Neurotransmitter is that next step. Once healthcare professionals or people who are working in the health system have graduated and are entering the workplace for the first time, allowing them having the ability to answer that question of, why are we doing things like this? Is there a better way we can do this? Normally those kind of questions get suppressed. We launched this in Galway Hospital. On that night we had 150 people who are at the early stage of their careers attend. From those 150, we had 27 ideas, and this is from one hospital, so 27 ideas, of which 10 were viable to take on further, and are now in the process of being implemented. It is our hope now that this is going to be rolled out. It's certainly going to be rolled out in Limerick, but rolled out nationally. And it's really down to the lead NCHD, which is Catherine Diskin, and Dara, who's there from the NDTP. It's also important to give people access, maybe not to the full-time jobs. They may want to dip into, be involved in innovation, to be involved in innovation challenges, hackathons, those kind of activities. Last year we run a hackathon or an innovation challenge around looking at digital solutions around bipolar disorder. And this was one of the first times which we started to be able to implement artificial intelligence in a chatbot around harmful behaviours. And there's probably somewhere, I'm looking at Emma, is Emma in the audience? I can't see her in the back. So this is one of the most important breakthroughs which we have. Vincent, who's sitting up there, is largely responsible for this, so he should really be talking about it. But Strength in Numbers was a very interesting progress. This was using, again, an innovation challenge to get not only teenagers involved around how do they look at their managing their disease and diabetes, but also having health behaviour experts, clinicians, nurses around it, and actually came up with a solution. The solution was the first aspect of using Snapchat. I'm far too old to know what Snapchat is, but it's using Snapchat so that teenagers can share stories or snaps with each other about managing their disease, but also getting that conversation around disease. And it successfully was published in European Health Psychology. Another program which we're running is Health Tech in partnership with NDRC. This is a summer project which is held over 3 weekends, giving healthcare professionals, members of the public, anybody who's interested in health technology, ability to come in, form teams, and come up with new ideas, solutions, or work with other people, idea generators, to come up with new technologies to divide. You don't have to leave your daytime job. You just can come in, give advice, give mentorship. Again, going back to my previous statement, one of our goals is making sure that it's so accessible for people to be involved in changing healthcare, being involved in coming up with new solutions for the challenges they see in a day-to-day capability. Also, which is very important for us, is that we develop an ecosystem. We develop a community around innovation, a community around technology, making sure that everybody is getting an opportunity to meet, everybody's getting an opportunity to swap ideas, and also coming up with new ways of collaboration. Two of the events which I've pinpointed here, one is the pint of digital health. I put the caveat that pint can be water. It's not necessarily alcohol. But that's our way of using the capabilities of the big multinationals, CSC, Canis, Cerner, and Microsoft, and integrating them and helping those 130 plus startups and SMEs which are currently based in Ireland, showing how we can look at the bigger guys helping the smaller companies to be involved in innovative projects, as well as allowing our own staff members to come and see and join through the projects. The health ecosystem, which is run by the CCIO, which I'll talk about in a second, is again a way of bringing people together and sharing information. Another key event for us is really to get people together and also to try and go out to the members of the public to show what we have, what kind of technology, which we're seeing, which is going to impact future healthcare. Last week we ran an eHealth Innovation Week. This year we're running a day called the eHealth Showcase. And this is an opportunity for everybody to come in, touch, play, feel with the technology. Although one of my more sarcastic friends said, an eHealth showcase, would you let people touch and feel? What are you going to have? 4 laptops? No, but generally for us, we see technologies such as VR, AR, which is a really good way of getting patient engagement, getting patients to touch, feel, getting members of the public to see what's coming down the pathway. As I mentioned previously, we have now one of the strongest networks of CCIO. CCIO stands for the Council of Clinical Informatic Officers. The that is made up with people who work within a patient-facing role or within eHealth, which are looking to be involved in accessing technology, enabling technology, and assessing what is coming through. Yvonne Goff has now been announced as the Chief CCIO, so it's obviously a difficult thing to say, Chief CCIO, so CCIO. And she will be responsible for all innovation projects coming through. My role itself is now going to be transferred into the CCIO, and a CCIO has been appointed now to be leading the innovation process and all the projects which you've seen today. So it's really important that now, for the future, that someone who is patient-facing and is involved in a clinician is clinical, be it radiography or within direct care, is involved in leading these projects so that we are getting more and more engagement of our staff members in the technology and all the innovation projects we were doing. One of the programs which we go out to engage with startups and SMEs, or anybody who has any questions around how to access the Irish healthcare system, is eHealth Connect. eHealth Connect is a monthly meeting in a different Irish city where anybody can book an appointment to meet, discuss, and ask questions on how they can access get their technology into the Irish healthcare system. It's also a way to signpost people into other areas within the Irish healthcare system which might be a benefit for them. As Brian mentioned previously, we have now set up a program called Quick. The program called Quick is fundamental for how we procure innovation into the Irish healthcare system, especially digital solutions. This is our opportunity to bring innovation in-house. It provides funding. It provides funding up to 25,000. But it's mainly looking at how we be able to go out to those 130 SMEs and say to them, please come to our clinicians, please come to people who work in HSE, show them their technology so that they can champion your technology through the Quick program. The Quick program has to be submitted by a member of the HSE or works in a hospital group. It's an online application. Decisions are made within 4 weeks of application. So it's a reason we called it Quick. It is a quick process. It allows fast access for companies to be able to work with people who work within the HSE to get their technology inside and validated. It's very important for us that there's heavy involvement of our teams around how to project manage these projects, but also that these projects are evaluated. Every project needs to be completed within 6 months, and there's 3 possible solutions at the end of the 6 months. 1, the project didn't work, and we say goodbye. Secondly, it only works at a local level. And thirdly, this is something which can be rolled out at a national level and needs to then go on to a national procurement process. One of the things which we do partner is with other national programs. There's the Health Innovation Hub in Cork, which is now national and is working with the John's BioInnovate and Tech Innovate as well. Arch is another project where we can be involved in, which is helping that interaction of researchers and companies and innovation vouchers and Enterprise Ireland. I'm not probably going to talk about this slide, John. You're going to talk about that. So I just wanted to actually highlight the good work which has been done here in BioInnovate and Tech Innovate. It's really essential that the more programs we have in Ireland. I think what is really important to me, and was identified when Satya Nadella the CEO of Microsoft came to Ireland last year, and identified that the digital transformation within Irish healthcare is the #1 innovation project in Europe. So the more projects we have, the more projects such as ours, the more capabilities that we can build in, then we can start to use the ability and the available innovation which is all around us to really ensure that we get our healthcare system fully digitized. I'm now going to quickly run through some of the companies and some of the SMEs which have been funded and are now currently in the Irish healthcare system. The first company I'm talking about is SwiftQ. SwiftQ is probably one of the longest going SMEs and startups which have been interacting with us. SwiftQ is an online portal for patients and clinicians, especially around the appointing system. Its technology is shown to really advance waiting lists and is now being currently used in blood labs and other clinics in St James's, St Vincent's, the Mater and Talley. TickerFit. TickerFit is one of our first health and wellness companies, CEO by Avro Copeland. It's really focusing on how to help patients with obesity, looking for rehabilitation, and using wearables and other devices integrated in with a portal to help them better look after their conditions. We're now currently have used this internally within Operation Transformation in the HSE, but also with in St James's. One of the more local examples is PharmerBot. PharmerBot is currently under trial in Galway University Hospitals. And this is a way of using, and this is from MedicNote, it's a way of using artificial intelligence to look at prescription errors. So far, they've identified over 600 prescription errors in University Hospital. And it's using a chatbot, so it's a platform which looks like it's talking to the person entering information in, but it's a way of quickly identifying errors. So that's a really brand new project. In Limerick, we're actually championing a technology called Pinpoint Innovations or Pinpoint Medical. This was developed by a 19-year-old engineering student at UL who left his engineering course, probably to his parents' horror, to form Pinpoint Medical, which is a new technology around how to identify where your patients are and, more importantly, where your equipment is. The company feels that they can save hospital groups up to $250,000 a year through lost equipment or equipment being misplaced. Finally, another company which we want to identify who came through the QUIC program is Salasso. Salasso is currently doing a project around in UL Hospital. And this is really focused on, all of us have been to physios. And when we've been at physios, how many of us can remember the exercises a physio had done? So this is a video platform which is on a tablet, which helps physios engage with the rehabilitation of their patients. And really give them an opportunity to be engaged with their rehabilitation through exercises, but also a portal so that they can be monitored at home. In the next coming months, we are going to be producing an interactive database of all the companies which we have met, all the innovations we have seen, allowing people, members of the public, clinicians, researchers, access to see the companies we're meeting so that we can build that level of engagement so that you, working in eHealth, can see the discovery of technologies and be involved in building relationships and collaborations. Going back to my first slide, I think one of the issues we tend to have is, being Irish, we're not very good at celebrating successes, and we're not very good at promoting positive stories. There's a number of really, really world-class work being done in our hospitals with startups, with clinicians, with researchers. And I think it's really important that we all use our social media, use LinkedIn, to really promote these innovations and really get those out so that people start to have that positive attitude around Irish healthcare. And it's really promoting the good work which has been done through the various schemes which you identified, Brian. So I think to find it off, I didn't have a smiley face, but I think the overriding message is there is good work. There is world-class innovations happening in Ireland, but there's a long way to go. And I think if we stay positive and share information and be collaborating with each other, that we can get there.